reporter for ABC7. Thank you for joining us for this conversation, a conversation about vaccination efforts as we wrap up Black History Month. The focus for this conversation is outreach to the Black community. Joining me for this discussion is Mayor Lori Lightfoot, Dr. Helene Gayle, the president and CEO of the Chicago Community Trust, and Dr. Terry Mason, who once led public health departments in Chicago and Cook County. Thank you all for joining me for this conversation. I would like to start with you first, Mayor. Patricia Friesen, a Black woman, was the first person to die in Chicago and Illinois from her battle with COVID-19 last March. This was a sign of what was to come in Chicago's Black community. Mayor, how much of a priority is it making sure people who need it the most get the vaccine?
Well, it's really the key priority. We think about the road that we've traveled over this last 11 months, and I remember her death very, very well. We have and continue to place equity front and center in our response to COVID-19, and particularly when it comes to the vaccine itself. Look, we'll get into this, but I understand that there's a long legacy of circumstances that have led Black people to be skeptical of the healthcare system, skeptical of everything related to things like vaccines, from the Tuskegee experiment to the tragedy of Henrietta Laux. But what I also know is that in Chicago, the life expectancy gaps between Blacks and other races is profound. The lack of access to healthcare, the comorbidities that have really made Black folks more susceptible to getting sick and dying of COVID-19 is something that should cause all of us great concern and alarm. And so while I understand that history, and we certainly can't ignore it, it is part of our present, we've also got to be talking to people about this life-saving vaccine in order to build a better future for Black Chicago and really all Chicago. That's what I think the focus has to be on in this time and place.
I know your focus has been equity and making sure that Black and brown residents get the vaccine. Where are we at? I know new numbers were released last week. Do you have any newer numbers?
Well, look, if you think about where we started, knowing that we were going to have a challenge on our hands, where less than 20% of the people who were getting the vaccine on a weekly basis were people of color, like 9% Latinx, 8% Black, we've done a significant, we've made significant progress. As of last week, over 50% of the people who have gotten the vaccine, first doses, are people of color. Now, no one's taking a victory lap because there's still a lot of hard work that needs to be done, but that's remarkable progress in a short period of time, particularly given the history and the hesitancy and concern around the healthcare system and certainly around any kind of government vaccine. So I feel very, very good about where we are, how we're positioned, but it's a result of the hard work that we've been doing for over a year to build relationships with trusted community partners in neighborhoods of color, and building trust with them as we go out into communities to educate people about the virus, to connect them up to the healthcare system. This is now bearing fruit and turning the numbers around in a positive direction for the number of Black and brown residents that are getting the vaccine.
What has been the biggest challenge getting the vaccine to the neighborhoods? Is it supply, venues?
Supply is the biggest challenge. We simply just don't have enough vaccine. While we saw a lot of hesitancy, and I really understood it, people wanted to know more about it. They wanted to see someone who looked like them actually get the vaccine. And now we've got lots and lots of examples. So I think the enthusiasm for taking the vaccine is actually rising week by week, but we simply don't have enough vaccine because of the incompetent way that everything about this pandemic was managed by the Trump administration. So we're working hard with the Biden team. They know that they've got a tremendous task before them and are really pushing the manufacturers to generate more vaccine. And I'm hopeful that we're going to have some very good news to be announcing in the coming days around more supply. But we just got to stay the course, be diligent. We built the infrastructure. We're making the adjustments where necessary, but we're going deep into every single one of these 15 neighborhoods. We call it Protect Chicago Plus, the 15 neighborhoods in our city that have been most hardest hit in Black and brown Chicago by COVID-19. Dr. Gale was with me last week. We were down in the Gage Park neighborhood. You just see this tremendous success story and people feeling like they are being heard and seen, bringing in their grandmas and their mom and dads, adult children, leading that effort, whole families getting vaccinated. It's a tremendous and uplifting thing to see.
And this is for anyone who wants to answer this. What are the challenges in terms of, I've heard from some people that people from outside their neighborhoods have been coming in to get the vaccine. So people in those neighborhoods where you're targeting are losing out. Have you heard that as well?
Well, I'll start and then I'll defer to my colleagues here who have a lot to contribute to this discussion. Look, we're not doing residency, right, checks. Fundamentally, you want to get everybody vaccinated. And yes, we still seem to have a high number of non-Chicagoans that are getting vaccinated, but ultimately that inures to the benefit of the larger good. We need people, period, wherever they come from, to get vaccinated. Obviously, we're putting a premium on reaching Chicago residents, but we need everybody to get vaccinated.
And Dr. Mason and Dr. Gale, I want to bring you two in for this discussion about the hesitancy of some Black residents to get the vaccine. I've spoken with some people who say that they're worried that the vaccine is not safe. Were Black people included in the trials? I've heard other people say, how do they know if they're getting the same vaccine as white people? And I know this is rooted in history. Can you speak to why so many Black Chicagoans may not trust this vaccine and trust the medical community?
Well, I'll just start and say, obviously it comes from a long history of discrimination, of mistreatment with the medical establishment and communities of color. And so, we know that there is a lack of trust that exists, but we also know that information, access, seeing others get this vaccine and seeing that it's safe has really made a difference in people's willingness to get the vaccine. And just like any community, the Black community is not a monolith. It is heterogeneous. There's a range of opinions about and feelings about this vaccine. And I think as more people who were eager to get the vaccine, and people see their neighbors, their family members, friends, et cetera, get this vaccine, we will see increased uptake. Will it take effort? Yes. Will it take building trust? Yes. Will it take trusted messengers? Yes. All of those things. But the numbers that the mayor talked about shows that with the right effort, in fact, we can get people to believe in this vaccine, but it will take doing multiple things. There is no one silver bullet.
I would also add to what Dr. Gales has already put out, that the provisions for safety that did not exist back when people were talking about the so-called, and I say so-called Tuskegee study, because it really was never a Tuskegee study. It was a United States Public Health Service study done at Tuskegee and in Guatemala. So we need to understand the truth. I want to put that out so you can go to Google the report and get it. It's out there to be read. But what I'd also like people to understand is that there are so many protections. And we've had several forums where we've brought people who've been involved in the clinical trial process. There are African Americans that are actually involved in the process. We had on my radio show, for example, we brought in the person who was one of the lead investigators for the Moderna vaccine, which the study was done right here in Chicago. And we had people talking about it, people who came in to volunteer for the study. This was not for the approved, or at least the vaccine that's been approved under an emergency use authorization. But these are people that were actually in the study, that were the people to whom we were trying to learn how would it work, what are some of the issues, and things of that nature. So I'm grateful for all the work that I've seen the mayor, the governors, everybody trying to do to make sure that there's absolute transparency. And now we have such protections and clinical research, and we've got people that look like us that are involved every step of the way.
And if I might, I would just say, I think this issue of transparency is such an important one. Part of the reason that there was such hesitancy, not only on the part of African Americans, but across the nation, was that this began in a way that was not transparent. We called it warp speed, which made people think that we were, taking shortcuts in developing the vaccine. People didn't know whether agencies were being manipulated to get things out by a certain date. I think now that there's much greater transparency about the process, about the data, and there's much more known about the longer term safety effects. I think in general, there is a greater sense of trust being developed. And I think that we can continue to build on that.
What do you say to people who compare this to Tuskegee? This is not the same situation, correct?
Not at all.
Yeah, I think Dr. Mason said it well. After the Tuskegee experiment, and as he said, this was not really a study. This was an unethical experiment on Black men that left them untreated, even after there was a known treatment for syphilis. Continued. This was a study that was supposed to be 6 months. It went on for 4 decades. And as a result of finally recognizing the wrong that had been done, all sorts of new rules were passed about how research had to be done to be ethical and what it took to have government research actually passed. So, we have learned a lot since then. There are protections that are in place. And I think that everyone should realize that we're in a very different situation than we were when that study was done decades ago.
Mayor, how do you fight that premise that people say that Blacks are not treated well by the medical community?
Well, look, I don't think that that's untrue, right? We all have our own stories about how we've been treated, not treated. I think what we have to do, though, is emphasize why it's so critically important in this time, in the city, for people to take this vaccine, because it will make a difference in life expectancy, because it will make a difference in their underlying comorbidities, because it gives us an opportunity to really right historic wrongs. There's still more work to be done. This vaccine doesn't wipe the slate clean of the history or the present regarding healthcare inequities, regarding access to high quality healthcare, which I believe, and I know both Dr. Gale and Dr. Mason believe, is a basic human right. We've got more work to be done, but we've got to be about the business right now of saving lives. And this vaccine gives us that best chance.
I know you've been speaking out about this, and some of the doctors have as well, about the safety of the vaccine. Are you making progress convincing people?
I think we are, and I think the proof, as old folks say, is in the pudding, right? We are seeing these numbers increase because of the hard work that's being done, literally at a hyper-local level. We've had people out in communities since the fall, going door to door, bringing people information, bringing them PPE, helping connect them up to neighborhood doctors, the federally qualified health clinics in their neighborhoods. So all of that work that's been ongoing, literally since the day that the pandemic hit the city, that work is bearing fruit. And we're leaning into that infrastructure, into those partnerships, as we continue to really educate folks, debunk the myths out there around the vaccine. And I'm excited and encouraged by what I think the possibilities are. And as we get more vaccine, the ability to really start going to the areas of most need in the city. We're doing that work now. More vaccine will just accelerate that process and help us really ramp up, bringing people into really the community of care that is necessary. And look, I'll say this too. As I said to my team from the very beginning, this pandemic has been incredibly hard. Every single person I know is bearing a huge burden of grief, of sorrow, of loss. But it also has given us a real opportunity. These healthcare disparities that we are all very aware of, we were working on them. But the urgency of this pandemic made us accelerate those efforts. So we have been working to build a foundation that will last us through after the pandemic into the future to address these underlying healthcare disparities. And this is the opportunity that I think we're all seizing upon to right historic wrongs and really help save lives in Black and brown Chicago. If we don't seize this moment, then shame on us. That means we're not seriously taking advantage of the opportunity to really build a healthier Chicago, and particularly in Black and brown neighborhoods.
You know,
I would just add to, I think I would totally agree. And I guess I kind of also, think about the investment that has been made in this vaccine. I mean, we have spent billions of dollars, including taxpayers' dollars, to get this vaccine. And it would be a shame if after all of that investment, the people, families, and communities who have borne the greatest burden of this don't have the opportunity to also share in the benefits of having this vaccine. It is a public health imperative, but it's also an economic imperative. People will be able to go back to their lives and their livelihoods once we are able to get this under control. And so, I think this is a public health imperative, but it's also an economic imperative. And it's what is going to allow us to recover from this pandemic, the public health aspects, but also the economic aspects.
The other thing I'd like to add to this conversation is that the vaccine is the only thing that we have to prevent this disease. It's the only thing. There's nothing else that we can take that's going to necessarily prevent it. That being said, we also owe it to ourselves to create an environment in our body, because we have already 2 major leading causes of death that kill over 1 million people every year. And unfortunately, we are, as Black people, overrepresented in that sample, and that is cancer and so-called heart disease. Mm-hmm. So the things and those 2 conditions, in addition to obesity and diabetes, are the underlying causes which cause the coronavirus infection to run havoc in our bodies, and actually are a major part of the mortality or the death rate as a result of it. So we have a double responsibility, not only to get the vaccine, but also to prepare our bodies so that whenever we get anything, or if we should become sick before we get the vaccine, which I hope that doesn't happen to anybody, that we're in the best possible shape and our bodies are in the best possible condition to help our immune system fight this disease.
Is there any concern that if someone gets the first shot and they start to have some side effects, that they may not go for the second dose, and then they will encourage others not to get the vaccine because of their experiences?
I think that the public health system, certainly here in Chicago, have anticipated exactly that concern. Some people are going to get side effects. They could be mild, they can be more severe. But one of the things that we do at the vaccine sites in the city is we pass out information where people can very easily, through a text message, sign themselves up, and there'll be somebody that follows up with them. How are you feeling? How are you doing? And if they are experiencing side effects of concern, other than, arm soreness, which is fairly common, then they're going to be connected up to care. So we're not leaving people by themselves to shoulder whatever the responsibilities are, or the side effects, I should say, following this vaccination. So this is a very, very well thought out process. There's a whole community of care that you become a part of once you get that first dose.
And Mayor and Dr. Gale, you all both received your first and second dose, correct?
That's right.
What were your experiences?
Absolutely fine. I have to tell you, I was concerned. I got my second shot last Friday. I woke up Saturday morning thinking, is this the day? And I've had remarkably, knock on wood, no side effects whatsoever. I've been doing pretty well.
Same, other than a little bit of a sore arm, nothing whatsoever. And I was very pleased. Now, we do know that after the second dose, after you've gotten your first dose and your body is kind of revved up, your immune system is revved up, people can have more side effects, but that's temporary. And it just shows that your body is doing what it should do. So, there is no side effect. There's no side effect that is worse than the disease itself.
That's
and
right.
So it's important that we remember how important it is. These side effects are temporary. It shows that your body is doing what it should do. But any side effect is clearly still different than a disease that has caused this kind of death and destruction.
Dr. Mason or Dr. Gale, how would you explain to people why some have side effects to the vaccine? What is your body doing once you receive the vaccine?
Well, I can tell you that most vaccines, I think even people when they take a flu shot, this is not unusual around about a vaccine. And we forget that our children, many of our children, I remember my children, now my grandchildren, have probably had more than 15 vaccinations by the time they're 10 or 12 years old. So, and everyone gets, because you're actually giving someone a protein that the body is reacting to. And that's totally normal for everybody that gets it. Some of the reactions may be a little bit more than in others, but it is not to be feared. And I think that as long as we record or report back to whomever we got the vaccine from or to our primary care doctor, if we're having things that linger beyond just some arm soreness or things of that nature, that's what, and I'm so glad that Mayor Lightfoot indicated that they do check back, because we do need to make sure that everyone is feeling well.
I'm interested in the conversations you all are having with your brothers, sisters, cousins, parents about the vaccine. I'm sure people are reaching out to you because they trust you. Could you go into a little detail about what that has been like?
Sure, I'm happy to start. I'm the youngest of my parents' 4 children, and I've got a brother who is in his early 70s, a sister who's almost 70. So we're having a lot of conversations as siblings about why getting the vaccine is important. I think I've convinced them all to take care of that. I'm still working on my 92-year-old mother who, as my older brother contacted me earlier today and said, have you talked to your mother? That's code. Have you talked to your mother? Because I'm the one who has to convince my mother whenever she's being stubborn about something. So we're getting there. But look, the bottom line is these are conversations that are happening, I think, in every family. And I happen to be the mayor and front and center on this issue. But like anything, you've got to educate yourself. You got to talk to your physician, get yourself comfortable. But I think as we're seeing over and over and over again, with the tens of thousands, if not now hundreds of thousands of people that are taking the vaccine on a weekly basis, on a monthly basis, we're seeing positive reactions and people understanding how important this life-saving vaccine is. I will just tell you now, having witnessed many of these, I'll call them vaccine ceremonies, the ones that are most poignant to me are the healthcare workers, particularly the first few rounds, where these people have been putting their lives on the line every single day throughout this pandemic. And to see them with this moment where you can tell the relief that they feel as soon as they get the injection, that they are going to be able to continue the work with a safety net, if you will, around them because of this vaccine. I mean, it's one of the most powerful images that I have experienced throughout this pandemic. And I share that to say, these are folks who are putting their lives on the line every day for us. And I think we owe them a debt of gratitude for sure, but we owe them to do our part to be safe, to take the life-saving vaccine so that their hard work and sacrifice has not been in vain.
Yeah, and I would add, I think we've all had these conversations, And, I think the most important thing about these conversations is to listen and understand why somebody might have a reasonable concern about this vaccine. So as an example, on my way over to meet the mayor in Gage Park, I hopped in a cab because I was late, and when we got to the location and it had vaccine on it, he started to ask me questions about the vaccine. This is somebody who's likely an immigrant, could very well not be registered as a citizen. He asked me about the vaccine, said he was skeptical, asked whether or not, what did I know about safety? I talked to him about safety. And then he asked me, well, do they check your immigration status? Do they check whether or not you're a citizen? And I was able to say no. So part of this, and by the time I got out of the cab, he said, I'm taking that vaccine. I'm as soon as I can, I'm going to take that vaccine. I think it's about listening to people and recognizing that people's concerns are legitimate and that we answer them with full transparency and as much compassion as we can. Because this is not about forcing somebody to do something. This is about providing people the information that they need to feel safe about this, to feel like this is in their best interest. And so I think it's about listening and providing the answers that will give people the opportunity to make the choice that's best for them.
And I think that we ought to understand that we're all in this together. So I'm one of five, I'm number 5 of 10 kids. So, and we're about half done. So I just say that my family members, my siblings, we all are in this together, whether we're in a nuclear family or in this family of the city of Chicago or the United States of America. And the only way we keep the family safe is for all of us to do our part. And our part is getting this vaccine to make sure we protect ourselves and everyone else.
Any concerns about the variants?
And if I might say one, and this kind of, Dr. Mason alluded to this, but I think it's important that we think about this in a holistic fashion. This vaccine was tested to let us know whether it would protect against the disease, COVID-19. There is still the infection, the coronavirus. Now, we know that this vaccine probably also helps to protect against infection, but we don't know how much and how protected. So it is imperative that even as much as we talk about how important this vaccine is, that people do remember to continue to wear their mask, to social distance, to wash their hands, while we have part of our population vaccinated and the other part of our population not. And that we remember that it is vaccines plus these public health measures that are going to get us out of this.
Great point.
We have about 5 minutes left, and then we're going to wrap. A couple more questions. Any concerns about the variants that are spreading across the country, across the globe, and what that means for our fight?
I think that the
Go ahead,
variants.
Dr. Mason. Go ahead.
Oh, I'm sorry, Mayor. If you want, please
No, go ahead.
I think that the variants are a normal part of what happens in the evolution of viruses. We are hopeful that the viruses, and from what we see preliminarily, that these particular vaccines should still be effective. Mm-hmm. However, we'll be watching to make sure that that's the case. And I think that a lot of work has gone into this. The good thing about these variants is they're not totally new viruses. They're just variations, sort of like brothers and sisters of the virus that we are already being immunized against. So, but I can tell you that there are many people watching that, particularly the vaccine manufacturers. And as soon as we have any indication that there is a problem, I'm sure everyone will know, and we'll have a plan for what we do going forward.
Yeah, I'm not going to play doctor, but I will repeat what I have heard through questions that I have asked regarding the variants, which is that the vaccines that are on the market now and available to us are effective against the variants. Now, obviously, the public health experts and the epidemiologists are following and testing these variants very, very closely, both here and across the world. But I think so far, we feel like whether it's Pfizer or Moderna, are very effective against these variants, but all the more reason why we really need to expedite the process of getting people vaccinated.
Yeah,
Go ahead. Sorry.
Just to add, a virus exists to be able to infect people. And so a virus will do what it needs to do to continue to be potent. And that's why viruses continue to mutate. But the more we do the things that we know that can control this, the less we will get mutations. So the more we get vaccinated and use our mask, hand wash, social distance, all the things that are, kind of fight against this, and the quicker we do it, the less likely it is that we're going to continue to get variants. So getting people vaccinated and following public health measures is our part for what we can do to reduce the likelihood that there will continue to be these mutants. And I would just say, we talk about this issue of equity and getting people vaccinated because we know it's the right and just and fair thing to do. It is also the best public health strategy. You always target things to the population at greatest risk. That's right. The greatest impact. And so that's what, besides the fact that this is right, just, and fair, it's also the best public health strategy.
I would add to that we don't even know about diseases like polio anymore, or diphtheria, or pertussis, or some of these other things for which we were immunized long time ago. Vaccines work, and that's why we don't have these problems today. And there'll be a time, hopefully in the not too distant future, that this particular virus will join the chorus of those other ones that we don't even speak about anymore because they're not here. And that all is on us to make sure we do our part to make sure that happens.
My final question is for you, Mayor. When are we going to return to normal, or what life was before this pandemic?
Well, look, I think all of us have been changed by what we've experienced and borne witness to over this last year. There's a new normal on the horizon for us, but I don't think we're going to go back to where we were in January and February of 2020. We've seen and been through too much. And as I said, I think we look at this as an opportunity to build a better city, a better society based upon equity, and really bringing people in to a community of care and support. So that's the normal, I think, that we are moving towards. But having said that, I do think the vaccine brings us closer to the light at the end of the tunnel, and that light is getting bigger and bolder, I think, every single day. But Dr. Gale, I think, has really said it right. The vaccine is an important tool, but it's not the only tool. The virus is still going to be with us for some time. And even after we get vaccinated, we still have to follow the public health guidance around wearing a face covering, social distancing, hand washing, those combination of tools that we all have at our fingertips. That's what's going to get us to whatever the new normal looks like. But look, I am very enthusiastic about what the next few months are going to bring. I think this summer is going to be a summer that feels like more like 2019 than 2020, but we've got to be diligent in order to be able to get there and enjoy that moment.
Perfect place to end it. Mayor Lightfoot, Dr. Mason, and Dr. Gale, thank you all for your time, and thank you all for watching wherever you're watching, at home or at work. Wear your mask and get the vaccine. Take care, everyone. Bye.